Hello, I'm here to talk to you today about something that I'm sure you're sick of hearing about, but that we need to go over one more time anyways for the people in the back. It is COVID-19. So we are now well over a month into this pandemic. It is April 13th, 2020, and I'm still seeing people post all of these things who are saying that we shouldn't be getting so worked up and everyone calm down. Way more people die from cancer every year, or way more people die from drinking and driving every year, or from the common cold, influenza, or community-acquired pneumonia every year. So everyone chill out, right? Wrong. I'm sorry that I have to tell you this. I am Canadian, so I don't like saying people are wrong. It feels very mean to me, but unfortunately, in this case, you are wrong. For the majority of the things that people are comparing them to, represented by these little cups here, and these little labels you probably cannot see, the majority of the things that people are comparing COVID-19 to are things you cannot catch. You can't catch cancer from sitting next to someone on the bus. You cannot catch heart disease from shaking someone's hand. So these are things that shouldn't be compared, but they're constantly being compared. And I understand why, because you're trying to put things in perspective. You're trying to look at the big picture. You're trying to remain calm. Good for you. I get it, but you're wrong still. So what we have here is we have all of these things that are kind of expected parts of living in Canada or the world right now, kind of things that we expect to make us sick or hospitalize us or that we could die from. And these are things that the healthcare system also knows that we could be sick from or we could die from. And so what I've done is I've made a representation of all of these causes of death and illness and heartbreak, and they are represented by little cups. These little cups, as you see, they have some room here. This is the room that healthcare professionals and the healthcare system has allotted for the unknown. It's additional deaths. It's a particularly potent strain of influenza that year. It's the Tide Pod Challenge. It's pandemics or natural disasters, things that we try and plan for that we can't accurately predict, okay? So there's a little bit of wiggle room in all of these things overall. So what we're going to do is we're going to see, here's the causes of sickness and illness and death in Canada in general. And what we're going to do is we're going to inject a little pandemic into it. The pandemic, in this case, is represented by crystal light, which is delicious. Probably more than a virus would be. So what we're going to do is we still have all of these expected maladies and deaths and illnesses and problems and stresses on our healthcare system. So these don't go away just because we've now introduced coronavirus. So we now have all of the same problems, a little bit of wiggle room, and a pandemic. So what we're going to do is we're going to start injecting a little bit of pandemic into our daily problems here. Here we go. We're going to inject right into, this is cancer, by the way. Cancer kills 79,536 people every year in Canada, approximately. And look at that. Oh, Canoggin. It's already full. All right, well, we're going to move down the line. We got some more wiggle room right here. That's heart disease, all right? We're going to inject a little bit of pandemic into there. And, oh, Canada, we're already full. So we're going to keep going down the line. Keep on going. This is accidents. This is suicides. This is drinking and driving. This one's influenza. There we go. Oh, shucks. We are stretched to the max with all of these things that you keep saying are worse than the coronavirus, but we still have more pandemic to go. While it may be delicious, it is still not good for our healthcare system, okay? And by delicious, I mean crystal light, not actual virus. Come on, guys. A little credit here. So this doesn't go away just because we don't have resources left. This doesn't go away just because you're woke and you're trying to compare it to accidents, which are 13,290, okay? Or when you're trying to compare it to influenza and pneumonia, which killed 8,511 people in 2018 alone. COVID-19 is projected to kill between 11,000 and 22,000 people in Canada by the end of this pandemic, okay? That's the best case scenario, which means we have a whole lot more to go and we don't have anywhere to put it. So look at, oh no, oh goodness me, flibberty gibbets. I made a mess. Just like you do when you don't bother to wash your hands and stay home and properly physical distance yourself. So you're saying, well, Emmy, No big deal if that's someone's grandma. It's not going to kill young people, whatever. Nah. Okay, that's fine, sure. All right, according to your logic, it doesn't matter, so I should just be able to clean it up, right? I should be able to just clean all this mess up, right? I can't because it's death. Okay? I'm making a huge mess. Now I need to clean that up. But I'm just trying to illustrate to you why when you compare deaths from a pandemic with other expected causes of death or hospitalization in Canada or in other countries, what you're really doing is you're ignoring the fact that those don't go away just because we have additional stresses on our healthcare system. You need to be respectful of the fact that healthcare workers and the governments in general are doing their best to try and keep you safe. We're not trying to wreck your day or bum you out or like rain on your Easter plans when we ask for you to stay home, when we ask for you guys to stop going to the grocery store 2 or 3 times a week, stop bringing your whole family to the grocery store. Go once every 2 weeks if you can. Leave the kids at home. Cover your mouth when you cough. Don't go anywhere if you have any respiratory symptoms. Stay home for 10 days. Follow the self-assessment tool that the Canadian government has available for you. And if you have any symptoms, call the 811 number, okay? Because this mess is avoidable if you would just take this seriously enough. You don't need to panic, okay? Coronavirus is not gonna come knocking down your door like a zombie. It's not that kind of crisis, but it is one that you should be taking seriously for the sake of our healthcare system, for the sake of all of those people who need those resources already to help them combat things like heart disease or cancer or influenza. So stay home, cover your mouth when you cough with your elbow, practice really good hand hygiene. Don't go on any play dates, don't go for coffee, don't go on social distancing hangouts, okay? Because we just need for you to help us flatten this curve. It's not flattening, and it's getting messy.